Hi, I'm Brooke Lewis from Partners in Diastasis Rehabilitation here in Denver, Colorado, and today I want to show you how to tape for diastasis recti during pregnancy. And we're going to use a less is more approach today. The reason we're doing that is because kinesiology tape can be really powerful and it can manipulate the visceral organ function if there's too much tension put on the tape. So we're going to use a recoil method, which allows us to put less tension onto the tape but still bring those recti muscles closer together so that your body, your abdominals can support your body during your pregnancy. And this will allow the tape to really do its function, which is to create a neurological input so that your muscles work optimally. Let's look at the tape. Especially if you're a first-time user of kinesiology tape, I want you to get a little familiar with it. I'm using a rock tape, this one here, and I use the gentle for during pregnancy. So I want you to take a strip of your tape and just cut a piece of it. We're going to take it to its full tension of 100%, so stretch it all the way out as far as it can go. And you can start to see that the light comes through, it becomes less opaque, and then back off to about 50%. You can see it gets a little bit thicker, and then go to just about 20%. This is the amount of tension we're going to use for our recoil method. We only need a maximum of 30% for the recoil, but there's already 10% loaded onto the tape without stretch. So we only need to pull about 20%. So that's what we're going to use for this application I'm going to show you today. So I'm going to bring Emily in here, our model for today, and I'll show you how it's done. Emily here, and she is also the physical therapist here at our office, and she does a specialty with pelvic floor dysfunction. So if you have a diastasis in your local, definitely check us out for that as well. She is about 7.5 months pregnant and has an impressively small diastasis of about 2.5 finger widths apart. So we're going to use a little bit shorter tape. You would determine how long your tape that you need just by the width of the diastasis. And we're going to start with doing a bit of a protectant layer with this particular spray here. And there are sprays you can find online. This one's a Skin Prep by Smith & Nephew. And there's also the option of using just a milk of magnesia as sort of a protectant layer, or to really clean the skin if you're having trouble with the tape sticking, you can try rubbing alcohol to get those natural oils off. So we'll just start with this with Emily today. And you can just spray some of this onto a cloth or a cotton ball. And I'm just going to give this a little bit of wipe on the skin. And Emily's had some tape on before already, so there's a little bit of red marks on her skin when we had not used this before. We had just tried a rubbing alcohol. So you might have to give it a few things a try and see what works best for you. We're going to do an X method. We're going to put an X with 2 pieces of tape below her belly button and above her belly button. We're going to purposefully skip going over the belly button because the kinesiology tape has a bit of an outward pull, and we don't want to create more of that outy belly button that naturally happens with pregnancy than there already is. So with the kinesiology tape, we're going to use it in essentially thirds. We're going to take the backing off of that first third of the tape. And I'm going to start with the X above the belly button. So I'm going to attach the tape to the outside of the recti muscle. So just about up here. With the anchor, there is no stretch on the tape at all. You just lay it down. And then really important part here is that I'm going to have Emily draw her core muscles in tight, like she's hugging her baby, so that those recti muscles come closer together and they're already in the position we want the tape to hold them in. And peel that backing off of the next third of the tape. And then give it that 20% pull. And Emily's still breathing here as she's holding. And then with that anchor, you're just going to pull the backing off and lay the anchor down without any stretch. And then you can go back to breathing normally. So just placing that anchor again, no stretch. Emily has a nice tight contraction of her abdominals. About a 20% stretch, and then just lay down that second anchor. And then we'll do the same thing below the belly button. It's helpful to just pull back the backing as you need it so that the tape doesn't get stuck to itself or to your fingers. And then we'll do one more piece of tape here. Just that little bit of stretch is all we need for the recoil application. Excellent. So if you have someone that has a longer torso, if you have a longer torso, then you might be able to do another X up top if you have that space. That would be fine too. If the tape gets uncomfortable for any reason, if you start to feel like there's some digestive distress or you're feeling nauseous at all, definitely take the tape off. Don't feel like that's something you should fight through. You might want to take it off, rest without the tape for a day or two, and then try a different application. And then if you have any questions at all about this taping method, then leave your questions in the comments below, and I will definitely do my best to get to those. Thank you so much, Emily.